Did you know that 1 in every 2,200 live births has some form of craniosynostosis? Let's take a look at what that actually means. But before we really dive on in, hi, my name is Ellie. I'm a mom of 2 under 2, and my younger daughter was diagnosed with metopic craniosynostosis. We found out when she was about 2.5 or 3 months old. Because of that, I kind of went down this hole of research. Okay, editing Ellie here in the way future from where this video was originally started to be recorded. I need to clarify a couple of things. The first and foremost is I am not a medical professional. Everything I say in this video is based off of research that I did independently because I was feeling overwhelmed about the situation and wanted to understand it better. The reason why I decided to put this video together was I wanted to try to help people who might be in a similar situation. So this video is based off of my research and also my personal experience with the medical system, helping my daughter through what she is having to go through. Most of this video, other than now, was filmed 3 or 4 months ago, and obviously in that time my older daughter did turn 2, and so I'm no longer a mom of 2 under 2, I'm a mom of 2 and under. So it doesn't make a whole ton of difference other than I do have a little bit more experience in this, and I won't be sharing a lot of that obviously because this video was filmed 4 months ago, but in the future I do intend to share. And of course, if you find anything in this video that is untrue based off of your experience and your research or your knowledge, feel free to leave it in the comments. I would love to correct it. I don't want to be leading anybody astray. I just wanted to hopefully help people find a little bit of hope, because sometimes when you get a diagnosis like this, like, oh my gosh, my 3-month-old has to go into surgery, like, of course you're going to be freaking out. And I wanted to give a little bit of hope to people that multiple kids have this happen all the time, and it is possible for it to be fixed, and it is highly likely that your kid will be just fine. It is almost assured that your kid will be totally normal by the time they're done with their procedure, whether it's a bigger surgery that is a total skull reconstruction, or it's a endoscopic surgery that requires a cranial modeling helmet to complete the process. But anyway, all that being said, back to the video. So I guess before we really get started talking about metopic craniosynostosis, we need to really pick apart what craniosynostosis actually is. So synostosis in general is the fusion of bone in an abnormal way. So craniosynostosis is the fusion of the skull bones in a weird way. So there are several different what are called sutures. They're joints in the skull when any baby is born, and they are supposed to remain open for a certain amount of time. Any synostosis is a congenital deformity, and that means you're born with it. There are a variety of different sutures, and because of that, there are a variety of different craniosynostosis diagnoses. The most common is sagittal, I think I'm pronouncing that right, craniosynostosis. And so the sagittal suture goes from the soft spot on the top of the baby's head to the second soft spot that is kind of in the back of the head. And when that happens, it kind of creates this elongated shape of the head. So that's the most common. The second most common is a singular coronal suture. Those are the ones that go from the soft spot at the top of the head down to like the temples. You can have 2 different kinds of this. Usually it's just one or the other that is fused shut too early, and that creates like a bulge in the head on whichever side is not fused. The third most common is metopic craniosynostosis, which is the same thing that my daughter has. And that is the suture that goes from the soft spot down to the nose, and it creates a triangular shape in the forehead. The last kind of suture that you have in the skull as a baby is the lambdoid suture, and that goes from the soft spot in the back of your head kind of down and across. So that is really uncommon to have either of the sides of that closed, or especially both of them. You can have a variety of combinations of the different sutures being closed, and when that does happen, there are different names for it, but for now, we're just going to be talking about the different sutures. I'm going to rapid fire some statistics at you guys really fast. Craniosynostosis in general is more common in boys than it is in girls. So it's about 2 to 1. So for every one girl that has craniosynostosis of some kind, there would be 2 boys. Boys have 2 kinds of suture closures that are more commonly seen in boys than in girls, and that would be the sagittal and the metopic. But girls are more often seen than boys having one of the coronal sutures being fused too early. Any of these poses a risk to brain development. Premature fusions of the skull can cause developmental delays because the brain just doesn't have enough room to grow and develop properly. That being said, it can also cause more than that. It can cause vision problems or seizures in some cases. It just depends on how severe your child's case is. The biggest thing, though, other than the developmental delays, is definitely the shape of the skull and the either stigmas or just the situations that can arise from that if it goes untreated. That's the thing, is all of these can be treated. For many of them, it would require surgery that cut the scalp from ear to ear and pull the scalp forward to reshape the head. If you have metopic craniosynostosis, there are a couple of alternate surgeries. My daughter is post-op for one of those other surgeries, and I'll get into that in another video, our story about how we figured out that she had it and how her particular surgery went. Later in this video, I will talk more about how it's diagnosed, and I will also talk about surgical options more than just what I mentioned. So yeah, with the affecting the appearance, it can also cause some respiratory problems, sleep apnea, or it can also cause hearing loss, which is kind of interesting to me. I didn't realize that that would be the case, but if the brain has pressure on it in a certain place, you would experience hearing loss, so it does make sense. Luckily, because of the odd head shapes, it's pretty quick to be diagnosed. It does need to be diagnosed early, and there does need to be an early intervention. Usually, it needs to be within the first year. For some of these, it's okay for it to go longer. For others, well, for most of them, you're going to want to catch it earlier than a year, but sometimes you have to wait till a year to have surgery. From my research, there are environmental or genetic factors that can cause craniosynostosis, but from talking to the surgeons and doctors and nurses and things that are dealing with this often, people who make the helmets and things, they were telling me there's not a lot of familial genetic situations that they see. That being said, environmental factors are the normal things you should avoid during pregnancy for lots of birth defects or genetic. Avoid the drinking and the drugs, and caffeine a little bit as well is known to be a risk factor. My daughter was crying in the other room. Apparently she woke up from her nap. Basically what research is saying is that we don't know why this happens necessarily, but we do know it does happen, and we have ways to intervene and kind of remedy that. To diagnose any kind of craniosynostosis, but especially metopic craniosynostosis, you need some kind of combination of imaging done. A CT scan is the thing that will usually for sure tell you that your child does or does not have an abnormal fusion of the skull bone. The reason why they do the imaging is because there are other conditions that can have similar symptoms, whether it's head shape or, maybe they're a little bit behind developmentally. For instance, my daughter doesn't smile very much versus my older daughter, who was smiling all the time. My younger daughter didn't even have reflex smiles, so that was odd to me. Treatment for craniosynostosis it can be easy and it can be kind of intensive. I would assume always requires some kind of surgery. Like I mentioned earlier in the video, you can have a surgery that cuts open ear to ear and pulls the scalp down and then reshapes the skull. And that one it's a long time that you're in the hospital recovering, between 5 days and 2 weeks. It just depends on the hospital, your situation, how far away you are from where you're having the procedure done, and things like that. There is an endoscopic version of it, at least for metopic craniosynostosis. My daughter had endoscopic surgery. They just did an incision. It'll be in her hairline, but it's not currently because they obviously had to shave parts of her hair off. More than that, like, she's a baby. Her hair is like gone at the top, or at the front and top anyway. But yeah, so there's an incision here. It's kind of shaped like a smiley face. And what they do is they take a bone saw and open up the suture and create space for the brain to grow and develop. Then after that, if it's not full on like reshaping the skull where you're breaking bones and reshaping them, putting plates and screws and whatever else, you have to have a modeling helmet, cranial modeling helmet. And that is usually 9 to 12 months of doing that. And then you also have follow-ups with your surgeon for up to when they're about age 5. And that's when all the sutures should be closed and your child should have the ability to just be. And that helmet is called helmet therapy. Helmet therapy is also used for when you have a baby that spends too much time on one side of the head or on the back of the head or whatever, where they have positional issues with their head shape. So to wrap up, we have visited what synostosis and craniosynostosis is, as well as some of the different kinds of craniosynostosis, and then we've also covered symptoms, treatment, and things of that nature. If you're interested to learn more, I will be putting out a few more videos about our specific experience, my family's specific experience, and how my daughter's doing, which, by the way, my daughter's doing great so far, but she does not have her helmet yet. So we'll see how that goes. If you found any of this information helpful, make sure you like this video and put in the comments any questions that you might have, and I'd be happy to do research about it. This is actually very therapeutic for me to be able to do research on this topic. I'm a very statisticky, sciencey, research-based mind, and it's allowed me to be able to do something while my daughter is experiencing something that I've never experienced. And so I don't know what it feels like. I don't know what it's like. I just know my experience, and I know that I am kind of going crazy trying to figure out how I can best help her. I have more videos coming, so make sure to leave your thoughts down below and any questions you have.